Hello, everyone. Today is January 20th, 2021. We are here for our briefing. It's just going to be me today. Jeff and Sarah hard at work on a whole host of items, so I offered to take the briefing today. I apologize for the delay yesterday. Um, to be completely honest, I found myself in urgent care twice this weekend and ended up having to take a COVID test, but thankfully my test was negative. And but I was unable to be at work yesterday, and I'm thankfully feeling a lot better and kind of ran myself into the ground there, but bouncing back and certainly a lot of work to do, a lot of things going on, and I'm feeling a lot better. So we're going to give you an update today on where we are. The two big things of note, obviously the vaccine, and with that, we'll start with our Montgomery County hotline, which is a wait list, which now has approximately 2,000 people on that list. We sensed, really, but with the state and federal government, it's been frustrating. Obviously the relationship hasn't been that good. The state has only been getting about 300,000 vaccines a week, and by opening up the eligibility far and wide, it created a massive demand, and people were having trouble getting answers. So we decided to open up a hotline. So at the very least, you could speak to a human at Montgomery County, and we could try to answer your questions and get you on a list so that when we do get the vaccines, and I'll get into that in a minute, that we can go right to that list and schedule people. And overwhelmingly, it has been well received by the people that have called. And I must really do a big heartfelt thank you to all the volunteers and staff that we've had that have helped. I mean, some days we had 8 people making calls all day long, and it's the type of thing where you'll start your day with 170 voicemails and finish your day with 130. But I think as a testament to our team, we had folks take lists home over the weekend and make calls from home and do everything they could to stay on top of it. And they've just done a really tremendous job. And I think, as we go through these difficult times, certainly you can see the worst in people, but you can also see the best in people. And I'm just so proud of our team, and there's a whole host of them, but just a few, Nancy and Morgan in the office, and Carl and Bill, and really Megan and everybody really stepped up. It's been really nice. So people have registered with us on a wait list, and then we will then use that wait list as we get county vaccines. Now, I'll remind you that as we go through the next few weeks, you're going to start seeing more and more vaccine distribution at multiple points. You have state clinics, you have pharmacies that are getting them, the county's getting them, the hospital's getting them. And our wait list is there, and we're going to use it, and that's how we're going to go through the process of registration. But I would say to everyone out there, keep your eyes open. If you're someone that is mobile and has access to the internet, certainly keep your eyes open. And if you can get a vaccine, whether it's in Montgomery County or not, I'd say go for it. There's get it where you can. There are no boundaries with this, and there's people traveling all over the state. And if you were that passionate about getting it as soon as you can, I'd say certainly there's nothing wrong with doing that. And really, what we're using our list for is, the folks that are in those categories. There's very specific lists for us on how right now we're looking at, 1A and 65 and over are the priorities that we've been given for our expected shipments. But, I just want to make sure the message is clear. Just spoke to the mayor of Amsterdam yesterday, had a great conversation about, when we get them mobilizing in Amsterdam, but we have the resources and all the staff in place to mobilize and put vaccines in arms. We're ready to go. We're prepared. And, the general consensus amongst, certainly our regional leaders is that, regardless of your political preference, and, quite frankly, for me, that's the least of my worries, but, there's expected to be a better relationship between New York and the federal government. And if that means, a more significant flow of vaccines to New York and to Montgomery County, that's good news for me. And that's the expectation. Again, it's speculation, but that's the expectation amongst many of the county leaders. So I hope that's true because we are ready. Today we had a large training in this room. This room was full of people that are going to staff our Montgomery County clinics. We've been, coordinating with, school districts, municipalities, fire departments. I had a great conversation with Chief Agresta in Amsterdam yesterday as well. And really, it's we're ready to go. So hopefully, the vaccine keeps coming in right now for this week. There's some good news out there. We're preparing to receive, implement, and roll out a vaccine clinic later this week, and potentially another one in the beginning of next week. We're told the shipment is on the way, and we're not expecting more than 500 at this point. We requested 3,000. Like I said, we're ready to put those shots in people's arms. But that's where we're at right now, and I know the hospital did receive a comparable, or is going to receive a comparable shipment as well. And in some of the calls that I was making today, actually have had talked to some people who were able to register with St. Mary's. So, again, I would say if you're very passionate about getting a vaccine, it's good that you're on our wait list. If you've called, if you've done the Survey Monkey or have called, but certainly don't be shy. If there's an opportunity for you to get it elsewhere, go ahead and do it. And if you could be so kind to let us know that you've received it, we'll take you off of our list. One of the other issues that we're looking to address are those that are in more vulnerable states. I think that's really the county's role, is people that maybe in their own homes, and I know there's some other counties that are looking to go right to people's homes. There's some regulatory issues there, but I just want people to know that's something that's on our radar, as well as having transportation resources in place. Should we need to move people and get people to the site, or vice versa. So those are all things we're working on. But again, we're ready for thousands of vaccines, and we do have some coming. We're going to be continuing the work. St. Mary's is continuing the work. I know our local pharmacies are continuing the work. I heard word that Fulton County is going to be having a pod up at FMCC. So it's starting to happen, but certainly not fast enough. What we're expecting for this week and potentially next week is certainly not going to meet the demand we have. So the public health department is going to prioritize and make the phone calls, and we ask that people, be as patient as you can. We understand it's a tough situation, but we're all working as hard as we can. And I think the wait list was a good step because it really offered people a chance to talk to someone, and to especially those that are older. And we had a lot of 70, 80, even some 90-year-olds.
A lot of 90s.
A lot of 90s, yeah. So it really served that purpose, and really the reason we did that was because we're obviously the confusion that was going on, but also understanding who we serve here in Montgomery County, having one of the oldest populations in the state. So those are the big points for me today. The only other thing I would add, other than just, again, thanking everybody that worked the hotline, is, we just got to hang in there. Hopefully things are going to get better. The numbers, I didn't come prepared with any specific numbers. Like I said, I just got back into the swing of things this morning after working from home for a few days and not being well. The numbers there's nothing really that stands out as far as a big increase or big decrease. We're pretty much where we've been at. We've had some good days and bad days over the past week, but that part is pretty, I hate to say it's standard, but at least we're not seeing continued increases like we were for many weeks. So that's relatively positive news, and there does seem to be some hope on the horizon related to the vaccine. So whether politics or not is playing anything to do with it, that's certainly a speculation at best. But I know that the general consensus is amongst the governor's staff, as well as the regional leaders, which includes Democrats and Republicans, is that they do expect the supply to increase as we go through the next few weeks. So that's my general update for today, and we'll look and see if we have any questions as to where we're at.
I am in an assisted living facility in Amsterdam. When might I receive the vaccine?
Sure. So my understanding is, and again, we talked about this at some previous briefings, that, our nursing homes are, contracting through the federal government. It's been going a third, a third, a third is the way they're doing it. We did get exact numbers on how many people have been vaccinated in our nursing homes. We can check with Sarah and see if that's a shareable document or shareable information. But we do know it's happening. It should happen, I would imagine, relatively soon. Again, it's the supply that's been the issue. But those pieces are in place. We're not directly doing assisted living or nursing facilities because those have a specific relationship with the federal government.
Why do we see people giving the vaccine out without wearing gloves?
That's an interesting question. I certainly wouldn't expect that. I haven't seen that. Rick, you haven't seen that at all, have you? I'd be interested to know where that happened. But certainly that, to me, does not sound like it's following protocol, and that does not happen at our clinics.
You sort of already answered this, but are there any plans for getting the vaccine to homebound seniors who can't get out of their homes?
Yeah, we're working on those plans now. There's some regulatory issues that need to be addressed. I actually had a conversation with Chris Mangy this morning. I have not had a conversation with Sarah since. We understand that that's an issue that needs to be addressed, and we're working on it.
Someone writes, last update I see on the COVID website is 17.65% as of 118 for our numbers.
Yeah, is that a daily number? Daily percentage positive?
I think so, yeah.
Yeah. So I mean, the dailies, those can tend to go up and down, but I can tell you the total number of positives that we've seen and our percentages have really been in line. I haven't seen any, real massive spikes that have been anything above and beyond what we've seen. Really? That's it?
If there's only myself and my mother in our household, she is 83 and I'm 63, do I have to wait for the shot?
So, for example, right now, we're working on 1A and 65 and above, and, so the mother would be eligible and the 63 would not at this point unless it was a 1A category. So I would say, for that person to if they're interested in Montgomery County's efforts, to call, get on the wait list. But also, please, you can look wherever you can. And, I know, and I've had some experience with people that are calling on behalf of family members and trying to, book appointments online for family members that may not have the resources to do so. And I think that's an important part of this. We've talked about all along about taking 5, trying to help each other out. And, I think this is another phase of that. If you have someone that doesn't have internet access or is not really, the type of person that's going to really try to see when these vaccines are coming up, and then you have a very small window to try to get a registration, try to help people out. Certainly can't hurt.
Do we have enough help with administering the vaccine or do we need volunteers?
Right now, I think we're good. I would say if you're interested in being a volunteer, sometimes we've even accepted some volunteers to help with the hotline. So if you're someone that's interested in volunteering, I can't guarantee you that there's going to be an opportunity to do so, but I've spoke to 3 different people today making some calls that expressed interest in volunteering, and what I've said is we're, going to keep their information, note that they've been willing to volunteer, and should an opportunity arise, we'll give them a call.
Why is only a student being quarantined in a house and not the whole family? Because there's no way that child is wearing a mask and keeping away from their family members.
Yeah, again, we've seen this issue along the way a host of times. I just went through it myself. I was on a quarantine, and there's 2 other people in the household. And you just have to do the best you can. And I think the important thing for the family members is to utilize common sense and just be as safe as you can and follow the protocols as best as you can. And that's really all you can do. There's no perfect solution. And you just have to do the best you can. All right. Well, that was relatively not too bad of a question and answer segment for today. Again, I have hope. We've come a long way. I think we just got to keep moving forward. And like I said, I'll just reiterate, we are ready and prepared to get the vaccines out the door as soon as we get them. And we are starting to get some shipments this week, and along with other stakeholders within the area, like the hospital and pharmacies, and hopefully we'll see this start to pick up as we go through the next few weeks. So, again, if anybody still wants to get on our list, call the hotline, and we'll take it from there. And in the meantime, we'll see you back next Monday at our regularly Monday at 1 o'clock scheduled time, and we'll take it from there. So in the meantime, hope everybody stays well and hangs in there, and we'll see you on Monday.